This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care is the freedom to practice medicine on my own terms. I am Dr. Harpreet Sui of Coronado Health Direct Primary Care, and this is my DPC story.
Dr. Harpreet Sui is a board-certified internist and obesity medicine doctor. She was raised in Central Florida and obtained her undergraduate degree at University of Central Florida. She then went to Touro University, California for her medical degree, where she also met her husband. They moved down to Las Vegas, where she did her internal medicine residency. During her time in residency, she found herself drawn to the forefront of evolving healthcare in the outpatient clinical environment. Dr. Sui knew this was her community, and this was where she would have the greatest impact. Dr. Sui has been practicing in the Henderson area since 2011 and now calls Las Vegas home. She is a fellow of the American College of Osteopathic Internists, and in 2020, she completed training in medical weight management. Welcome to season 4, everybody. Welcome, Dr. Sui. This is such a treat. We have, as with many people who come onto the podcast, we have totally been in the same digital space on social media, but this is such a treat to be able to open this season and to have somebody who has gone from the fee-for-service world to opening up their own clinic to blasting it out of the water when it comes to growth. So again, super excited, and thank you so much for being here.
I'm so excited.
Awesome. So let's get started with your journey into DPC. You were a person who, just like many of us who've gone to medical school, we just end up wherever we end up. You went from Florida to California to then Nevada. So tell us a little bit. So for the listeners, tell us a little bit about your journey into your medical career and how you ended up in Las Vegas.
So I think like many of us, I wanted to be a doctor since I was young, and I grew up in Central Florida, so right outside of Orlando, and I needed to get away. And I always had this idea that California was like the place I needed to be. When I was applying for medical school and I got into Touro, California, I was like, that's it, I'm done, I'm going. I went there, and then ironically, I met my husband in medical school. And so then my life totally changed. And when it came down to us going for residency, we wanted separate paths. It didn't really work out that way. He wanted to do a different specialty. I wanted to do internal medicine. And then we both ended up saying, hey, let's just see what happens. And he decided ortho really wasn't the one for him. And he really enjoyed medicine. And then Las Vegas had a newish program at the time. And so then we came down here, did our residency with the hopes of leaving, but we really just fell in love with the city and the state. And we saw that there was a need, especially I saw the need for primary care. And I knew I just had to stay. And we've been here ever since.
And when you guys met in medical school, and I'm asking this because I saw a post, so I have to clarify. Was there anatomy tank involvement in this situation of you and your husband?
100%. We were like diagonal from each other in anatomy lab. And it was Tuesday afternoons, and I had such a crush on him. And instead of dissecting and paying attention, I would walk over to his table and be like, "Hey, Kevin, look at that dissection skill." And I would legit flirt with him over the anatomy table. And that's how our love story grew.
What a story to tell the kids. Oh my gosh. Amazing. That's an amazing legacy. And one that I'm sure there's so many listeners who are like, oh boy, she was that person. Like, oh, I love it. I love it. So that's awesome that you guys found your calling to medicine, but also you were able to end up geographically in the same place, because we all know people who, even after residency during fellowship, they potentially were married and lived in different areas of the country. So that is fantastic. Now, when you say that you recognize that there was a true need for primary care, we think Las Vegas, and the most stereotypical thing is like, oh, people who work in hotels. So can you give us, from your perspective of a primary care physician, what was it that spoke to you about the community that said, oh, primary care is really needed here?
So speaking of those people that work in the industry, so everyone who works in hotels, they all live outside of the Strip. And I remember when I first moved down here, I was like, wow, there's a whole town outside of of Las Vegas Boulevard. And so all of those people need doctors. And what happened back when I was training in 2008 is that a lot of doctors would come down here to train, and we did not have a lot of residency programs like we have now. And then they would leave, or doctors would come in and stay for a few years, make money, and then leave. It's a very transient town. So during residency, when I realized I enjoyed the clinic more than the hospital, that's when I started to see that there were these people who lived here, who had lives here, who had families here, who needed a primary care doctor. And there just wasn't enough of us for the amount of patients that went around. So they were waiting 3 to 6 months to see a primary care doctor, even for like a routine regular appointment.
It's so interesting because you think about where people go to gamble, where people have 7-figure incomes and they're just disposing it for a fun night. And that's in their right, whatever. But at the same time, you have the opposite end of people who, because of their financial status, they might not be able to have the concierge doctor show up at their hotel room or whatever. It's very interesting to hear about that there is life outside of the Strip, and that those people, like clearly, like every American, needs access to amazing quality primary care. So when you were in your training, in your settling down in Las Vegas, at what point did you start to think about, I could actually see myself doing my own clinic as a private physician after residency?
So we ended up staying here because my husband did pulmonary critical care fellowship. So then at that time, I graduated and I had gotten a job in a private practice, in a regular fee-for-service private practice. And I was probably there for about a year before I started realizing, I think I can do this. And I mentioned, as I've always had this dream to potentially have my own practice, but they don't teach you how to do any of that in residency. So you get out of residency and you're like, I need a paycheck, I have loans to pay back, and I guess I'll just take the very first job I was given, which ended up being a blessing in disguise. But that first job was not the easiest job. And so that's how I started maybe planting the seeds in my brain that like, I would love to have that own practice of mine in the future.
Definitely. And with your husband being home critical care, is he still primarily hospital-based right now, or did he do outpatient as well?
He's primarily hospital-based. Yep. So right now he splits time in pulmonary clinic, but he's mostly in the ICU. So that comes with a long schedule, long days.
The main reason I wanted to ask that was because I didn't know if he had also ventured into owning his own company and the setting up of the legal entity and all that stuff. But for you, without having very obvious, this is how to survive after residency, whether or not you want to open your clinic or not, how did you start developing those skills to be able to work towards opening your own DPC?
So we did a lot of moonlighting our third year of residency. So certain things we knew, like how to open a business and all of those things. And I was really lucky that I have my mother-in-law who used to work in the financial world. So she was very smart at these things and really helped us make those decisions and make those choices. But I started asking everybody I knew who ran a private practice. And it was a lot of, oh, hey, like even my dentist. Oh, hey, you opened your own dental clinic. Like, how did you do this? What did you do? What are the pitfalls? How easy is it? But I had a lot of changes during my clinical practice because this is my fourth job. So I've worked over a decade in fee for service. And so there were a lot of times where I would just say, I'll just stay in fee for service because I have a 401k and I have benefits and I have all this. And that seems really hard. But I couldn't have done it without everyone I know who owns a private practice. And I'm the kind of person that I will cold call you and say, hey, can I talk to you? How did you do this? Because I need some help.
Amazing. This is the perfect seeds for a DPC doctor right there. You don't know me, but I called you, especially because you're a DPC doctor, and I knew that you would be getting the message even if I had to leave a message. I remember calling Dr. Lauren Hetty's voicemail because I needed to get a hold of her and I couldn't find her cell phone. Then it was like, I'll just call her office because I know she's going to get the message. So I love that. Now, at what point in your journey did you learn about DPC as a model to practice under versus a fee-for-service model? Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
To be very honest, I learned about DPC in the fall of 2021. I had worked in a concierge practice, a traditional concierge practice in Las Vegas, where we were billing insurance and also doing the membership model. And so I didn't even know DPC was a thing until late 2021. And then December 2021, I said, that's it. I guess it's time for me to start building this business.
I love it. And with that, being in Las Vegas, being in Nevada, and being part of a concierge practice prior to DPC, did you have any issues breaking off from that practice to then go into your own?
No, luckily my partner in the concierge practice was my former senior resident. And I went to him and I said, I have this dream. I think I can make it a reality. He's known me for over a decade and he was just really happy for me. And so it was just a very amicable, I'm leaving at the end of my contract. I'm going to open up my DPC. But even if I needed him today, I could call him today and he would give me advice. So it was really easy.
I wish corporate medicine treated physicians like that, but sadly, not the case. Yeah. No, this makes your story even more powerful, I feel, because with you learning about DPC in the fall of 21, and then by the time of the end of 23, almost the end of 23, you had over 150 patients and now more because we're past November when we're doing this interview. I want to ask about the quick turnover from concierge practice to your own in terms of how did you then go from that time in the winter of 21 to opening in August of the next year of 22? How did you plan the financials? How did you plan the legal part of your DPC?
So one thing that I want to make sure that other people who are listening understand is that I've been practicing in Henderson, Nevada since 2011. I've had patients follow me from practice to practice to practice. So I had a cushion of patients before I opened in August of 2022. So in terms of the legals, I went straight to the people that knew the most. So I am very much, I will seek out the smart people and have them help me. So I call my CPA, I call my business lawyer. We walked through how to open up my own business, how to tax it. And then I asked every question I could on every single DPC Facebook group. And I started again calling everybody I knew. So I called Dr. Jade Norris. I talked to Dr. Debbie Sutcliffe. It was just I need to talk to everyone who's already done this and I need you guys to guide me. And that was really the one thing, having that group of people that were so willing to help you was the thing that made me realize that I could do it. Because I just got so much encouragement from everyone to be like, oh no, we can do it. You could totally do it.
I love that. And I think that speaks to the power of our stories, right? I think that really Like when you're doing something new, it really helps to hear someone like you, someone who's had the same struggles, trauma, experiences that they love about medicine, similar to yours, to be able to say, wow, I identify similarly to that person. If they could do it, like I can too. And I really think that it helps, like you're saying, it helps push a little bit more of that rock up the hill in terms of getting to opening day. So when you talk about the legal portion of setting up your DPC, setting up your business, setting up the taxation, we've heard little bits about Nevada, but from your perspective, what are tips that you have for the listeners in case they're wanting to open up DPC in Nevada as well?
We are having issues with malpractice because of the way that the laws are in the state. So I would shop around for malpractice. I chose to do an occurrence policy because I had an occurrence policy with my previous practice. So I just brought it with me into this new practice. And I did opt out of Medicare, which has made it quite easy. And I would say to anyone who wants to open a DPC in Nevada, we are a Medicare heavy state. We have a lot of retirees that come out here, but you can still have a successful, thriving business by opting out of Medicare. And I just, like I said, any question I had, I went to my lawyer. Any question I had, I went to my CPA and said, hey, is that legal? Can I do this? Can I do that? And it just made it a lot easier to be able to get all your ducks in a row.
When you talk about legal advice, do you see any difference between someone whose legal practice is very highly focused on direct primary care versus physician legal matters?
My CPA manages a lot of physician practices. So he actually learned about DPC along with me. Like I keep teaching him stuff. And so we learned together, but I felt like I didn't need somebody specific for DPC. I will say that I did use a DPC specific lawyer in a different state to help the legal paperwork, the templates and all of that, which I felt was something that I could do because my current lawyer was like, I don't really know DPC and I don't want to do the wrong thing. But I felt anyone who is well-versed with running a practice or managing the finances of a practice in general, whether it be medical or dental or like a veterinary practice, is very well suited in helping you with the legality of it all.
Let's go back to Medicare because you talk about how Nevada is Medicare heavy. When you talk about the patients who followed you to your DPC, can you give us an estimate as to how much of your patient population was receiving Medicare benefits when you opened?
I would say 45%. The vast majority of my older patients have followed me for every single job I've been in.
That's such it makes me so happy for you. I feel it's so humbling and it's just, I'm struggling to find a word other than wonderful, but just, it is so amazing and so wonderful that people value your care as a physician and all of the things that you bring, yes, in training, but also you as a person, that it speaks so highly to your care as a doctor. So I just love that.
It makes my heart so warm and fuzzy. And all of my older patients never batted an eye when I said, listen, I'm not taking Medicare. You also have to sign this paper saying this contract. And then also you have to pay a fee. In fact, I would say half of those 45% when I first opened would bring me breakfast because they thought I wasn't making any money. They would honestly say, are you making it? Should you raise your prices? I brought you a bagel. I just don't think you're eating. Are you eating? You should sit down. And it's just so sweet. And the fact is that they value that they have a doctor that they can sit down with for 45 minutes. And that's really sometimes all they need is just that Dr. Sui's in my corner. So I'm just going to ask her all these questions. And now I feel better. Now I can go.
It reminds me of this picture that I'd seen posted earlier today. And it was like, I was raised to treat the CEO the same as the janitor. And so I think this model allows us to really serve in that sense of it doesn't matter. Yeah, it doesn't matter who you are.
Yeah.
You're still a human being. Fantastic. I went to human doctor school. Like I didn't go to veterinary school, but I went to human.
Yeah. And you know why? And so I come from a small business family too. Like my parents had a small business growing up. I'm the first doctor in my family. So I know what it's like to be in different socioeconomic classes. And so I feel like when a patient meets me, I am literally just me. I'm not, hello, I'm Dr. Sui. Nice to meet you. I literally open the door. I'm like, hello, how's it going? Like, how was your vacation? They value that you know that about them.
Yeah, no, it's so cool also to be able to let that part of you shine without having to be like, I'm holding back a little bit because I have a patient in 15 minutes.
Yeah.
So wonderful. So let me ask you now about your space, because you have a beautiful space. It's all over your
Thank
social media,
you.
which we will get to. But how did you come to find your space for your DPC?
Okay, so I had a budget set that I wasn't going to spend more than $1,200 because that's what I had made in my mind. And when you're building a business, it never goes the way that you expect it to be. So looking at the end of 2021 in Las Vegas, where I was, there weren't a lot of small spaces. And in fact, I wanted to stay in the area I had always been. I wanted to stay more on the Henderson side, so closer to my neighborhood. And everything was large. There were huge spaces that I would have to take apart and build from the inside. So I was searching online and I saw this space and I knew that there was another doctor on the other side and she'd been there for many years, traditional fee for service. And so I knew the space would fit. And I walked into that space to go look at it and I just knew. It was like when you pick your wedding dress and you're like, I'm going to say yes to the dress. I said yes to the office. I said, where's my side? Do you want my money? How can I get into it? It's small. It's 1,100 square feet, but it's perfect for me. Small waiting room, one office, one exam room, and I built out a lab. So for me, it's the perfect space that feels cozy. Many of my patients say that it feels like they're coming into my home as opposed to going into a doctor's office. And so I love that space.
That's awesome. I feel like we need to have a whole campaign, say yes to the office. That's
Yes,
amazing.
I think we do. Because a lot of times we have this idea that it needs to look like this, especially if we came from fee for service. It needs to have 10 rooms and it needs to have all of this and it needs to look like this and it needs to look like that. And then when you start to realize that so many doctors I spoke to online were like, oh, I'm in an executive suite. Oh, we know doctors who have offices in casitas or in other parts of their home. And so I said, I'm just going to take this non-traditional space but it's built. So like I can decorate it however I want. And I can just like give myself that freedom that I've always wanted.
This reminds me so much of the talk I had with Dr. Rishmi Kapoor, who is in Brooklyn. And she's like, I decorated my office like my dream. Like my home's not like this, but this is like what I have always envisioned. I'm like, girl, when there's a Hearth and Hand sale at Target, I'm like, sometimes I'm texting Dr. Christina Dahl and I'm like, girl, look at what I found today. So I love this.
Yeah,
So,
100%. We built the entire office. It's like a combination of IKEA, but it's like cool colors, but it's beautiful. And my house looks nothing like it. The office is my favorite space. My husband will call and be like, are you coming home today? I'm like, no, I'm having a coffee in my office. I'm watching Netflix. I'll be home in an hour. Leave me alone.
oh man. This is so not fee for service right there. So not fee for service. Oh my gosh. So tell me about your choosing your name, Coronado Health DPC, as well as the color scheme behind your branding. Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
So I actually chose the name based off the area in which I wanted to be, which is not the area where my office is. So there's Coronado High School and there's Coronado Center, and I was going to stay there. So I said, I'm just going to go with that. So it diversifies that part of our neighborhood because all these other things had already been taken. And I had a really hard time picking a name. That was really the hardest thing out of everything I did, because that's the thing that represents you. I said, I'm going to call it Coronado Health and I'm going to stay in the Coronado area. And it didn't work out. I'm about a mile up where that is. But when I did the color scheme, my favorite color is purple. So I branched off of there. So purple is the color of royalty. I just love that color. And I wanted it to be a place where you felt calm and welcomed and cozy And literally like you're coming to my house for a cup of tea. And so I branched off the navy from there and the white and then a little bit of pink and the purple. And it just gives it this very fresh kind of vibe in the office that I love. And that's what I stuck with.
Awesome. And you definitely see that on, like I mentioned, your social media. So let's talk about your social media. Since you opened, you're continuously posting. I loved watching your holiday ones, especially. One of my favorites that comes to mind is everyone remembers those like Tom and Jerry. Okay, I'm so dating myself, but like the Tom and Jerry or the Looney Tunes hallways where there's like multiple doors. And there's Dr. Suey like going from one door to the other with her antiseptic spray, trying to fight the flu off. And the song is All I Want for Christmas playing in the background. Is hilarious. So in terms of your social media, we talk a lot about how people market their practice. And yes, you were in the Henderson area for 11 years. You had patients who were with you opening day one. But I want to ask about social media in general. How have you found it helpful to your practice so far?
This was the toughest part. Opening the clinic, getting the patients, doing the medicine, that part is all easy. Social media has been the toughest thing for me because now we're in an age where there are so many doctors on social media. So what I realized from the beginning is that my patients don't find me through social media. My patients are actually finding me through word of mouth. And so I'm not going to get patients from social media, but I can use social media to market my stuff. So that's the decision that I decided to make in terms of, instead of marketing the practice to get more patients, I'm just going to market myself as somebody who is an internist, who's in Las Vegas, who is goofy and what is up for anything on social media. And so my page has grown a lot from my very first post because I did not really know what I was doing and I wasn't really sure in which way to go. And some of our doctor colleagues are brilliant on social media, but I will be very honest, I, again, outsourced this one. So I was very lucky to go to a Henderson Chamber of Commerce event just to get to know more people and talk a little bit about my business. And I was getting in the elevator and I was holding the elevator door open. And this girl walks in and I was like, "Oh, hi, nice to meet you." And she was so bubbly. And she goes, "Hey, I work for a local digital marketing firm." I said, "Oh, that's so interesting. I've been thinking about getting into socials better, but I don't know how to do it." Long story short, we hit it off. And because they're local, literally down the street from where my office is, it's made it really easy for us to come up with a plan because, again, social media it's part of the growth of your office, right? So when you grow your office, you're thinking about, where do I want to be 2 months from now, 6 months from now, 1 year from now? And social media actually needs to be looked at from that same perspective. Where it is that, what do you want for your social media and where do you want to take it? I have 100% had a company step in and help me out. And together we're making all of these super fun videos. That video is so fun to do.
Love it. So when you talk about this, thinking about the future and working backwards in terms of your strategy for social media, when you're working with a company, do you guys like meet regularly and brainstorm on, okay, this is what's coming down the pipeline for, like, now I want to offer, like in your case, like you have obesity medicine, you're board certified in obesity medicine. So you have programs specifically for people who are interested in focusing on obesity medicine. How do you collaborate with your social media team to say, okay, I'm Dr. Suey, I am the brand, and I want my social media to reflect X, Y, or Z?
So one thing I had to realize is that I am the brand. For a while, I thought it was the business, but we really are our own brand, which is why we have to bring ourselves into our social media. And so we sit down once a week. We have a meeting for what we're going to lay out for the next week of where we're going. And then we have ideas for what we want to cover for the month. So February is Women's Heart Month. So we're going to do a lot for there. We just see what are the topics that I want to touch base on. I really want to start talking more about the weight loss portion of the practice. So how can we build that in? And what are the ways to make the videos, the social media accessible over all the platforms? So we do recording together because this is what they do. They're pros at it. And then we'll do, like I said, we'll do drafts on, hey, I love this TikTok video. Like, why don't you think, what should we do this? Sure, let's try it. So a lot of it is collaboration. I probably talk to them every couple of days.
And when it comes to just not only focusing on what the strategy overall is, but also honing in on what people are engaging with, how do you guys look at your analytics and what type of post do you find is most impactful so far?
so far, what we really realized is that the most impactful posts are the ones where we are talking about medicine. So I have one post from a couple weeks ago where I discussed that my irritable bowel syndrome diagnosis was just taken as anxiety when I was younger, not like how women's pain isn't really taken seriously. And that one got a lot of people talking. And so what people want to see on social media is not only that doctors are human and totally normal people, but also that we understand that people go through stuff and sometimes all they want is somebody that'll listen. And if we look at the analytics, what I find is a lot of my a lot of the people that are watching me on Instagram, let's say, are usually women between the ages of 30 and 44. And so that's also like part of the practice I'm trying to grow. That's not that we should ever have a favorite population in our practices. We should not. But because I am a woman between the ages of 30 and 44, although not much longer, that is like a group that is all my friends. It's like you and me talking, right? So I like to tailor my stuff to them. I have a lot of medical students, so I do a lot of stuff with med students and I make sure that I put those posts out too. So I look at the analytics every week and then tailor it from there as well.
Awesome. And with you being so involved in the next generation's exposure to DPC, I want to ask about hashtags, because as you're finding what gets exposure to people about you and the brand that is you, but when it comes to specifically people in training, medical students, residents, what hashtags have you found helpful to engage that demographic?
I feel like I can talk most on Instagram, and the Instagram algorithm is very confusing. And so hashtags like medical student training, specific rotations, pediatric rotation, family medicine rotation, surgery rotation, residency, those things I think are the things that pop up, but the algorithm changes so much. I feel like daily that it could be a whole different set of hashtags the next day.
Awesome. I think that might give people hope that they didn't have before, that you don't have to always do it one way. If you've seen one DPC, you've seen one DPC. If you've seen one social media post, you've seen one social media post. So let's talk about now collaboration, because recently you've been doing some collaborations that are super fun with Desi Doc Mom. So how did you guys come to collaborate, and how is collaboration helping you as a doctor, as a person, and as a owner of a practice?
So this came to me because Desi Doc Mom, Ashwarya, she is a friend of mine locally. So she's an internist, I'm an internist, and we started following each other outside of our friendship. And she came to me and said, hey, wouldn't it be fun if we started filming some videos together? So she comes to my office on her lunch break and we'll film 2 or 3 videos. And it's so fun to do them together. And I think it helps both of us in the long run because we have similar goals on social media. We want to talk about the mom thing. We want to talk about being a wife, about being a doctor, about being an internist. And so it's fun to collab with them because they come to you with completely different ideas, things you would never do. When you have somebody like that, you're like, okay, yeah, let's try this crazy dance. I don't know. Let's just see what happens with it. So it's been really fun.
I love that. And as you mentioned, being a mom in this whole situation, and I'm not going to say you're almost 50 because it's so not true. Like, you're not over that hill yet, girl. And hashtag Asian don't raisin. So
that's right.
Yeah. So when it comes to, as you've been talking, like, so not what you would hear a doctor talk about in fee-for-service. Yes, there are influencer physicians who are in fee-for-service, but this is super happy and it's not snarky, right? So I love that you're sharing all of this. But I want to ask specifically about being a mom and a doctor and a DPC doctor and a business owner. What has changed, given that your kids are a little older? Like, one of mine is still in pull-ups, probably going to be for quite some time, but yours are beyond that stage. So how has your life been impacted because you're no longer in fee-for-service when it comes to being a parent?
So I'm going to take us back to 2016. So I was pregnant with my now 7-year-old. I was in a fee-for-service job. I went to the CMO and I said, I know that I work 0.8 right now, but my husband is home critical care and I need to decrease to 0.6. And he looked me dead in the eye and he goes, no. And I said, sir, I have to drop my son off at school. And he jokingly says to me, why don't you just let your son walk to school? Mind you, my son was 3, not even 3 at the time because I was pregnant. So he was like 2 and a little bit. Funnily enough, he's a pediatrician. And I think he meant it as a joke, but I left that meeting so dejected and I had to come back to him with proof. He needed proof that I would still be able to give access and see the patient so that company could make their money if I only worked 4 days a week at 0.6. So that's when I said, this is ridiculous. And so I stressed a lot when the boys were really young. My boys are now 9 and 7. And it was really tough being in a 2-doctor family, which I think is not talked about a lot. Having 2 doctors with one as a subspecialist and his schedule. And again, I always say the only reason I do what I do is my mother-in-law lives with me and she is an angel from heaven and she does all sorts of stuff for us. But it was really stressful during that time. The kids were young because I was missing things at school. Now, fast forward, August 2022, and my life is so amazing. I have never been, I think you can tell in my voice, so happy. I'm so happy. This morning, I went to one science fair. And I fielded calls from my MA who was like, hey, can we book this patient? I was like, yeah, I'm at the science fair. Like, book it for next week. So I have freedom that I never had. I don't have to answer to anybody, right? I can make my schedule around when I need to. I can bring my kids to the office if they're sick. My office is 3 minutes up from their school. So I can pick them up, bring them back. I can pick them up from school, take them home. My patients love it when the kids are in the office. They will spend more time talking to them than they will talking to me. So I now have the freedom I never had. That I feel like as doctors, we shouldn't have to prove that we need to be able to see 30 patients in 8 hours. We shouldn't have to prove anything about ourselves because we have the knowledge to do. So DPC just has given me that ability to be a better mom. I'm a much better mother. I'm a much better wife, and I'm a much better doctor.
Earlier today, I was reading this post from somebody who works at a private hospital, and the notice to the employee was all providers and full-time staff are required to work 8 hours per day, 5 days per week. If you take a half an hour lunch, you will need to work 8.5 hours. And if you take an hour lunch, you'll need to work 9 hours. And please use your downtime during your daily schedule for paperwork notes. PCPs, we would like you to refer to patients to the specialist within our system if possible. And we should like to see 32 patients scheduled per day with at least 20 to 24 being seen. New patients will count as 2 time slots.
Oh, gosh.
Yeah. It's just the people who are listening for sure are, one, shaking their heads in disgust, but also not in disbelief. That is 100%. So real. Yeah. That is so real.
We all have those stories, right? We all have those stories. One thing I tell every med student that comes to me and goes, actually, with the student I have this month, she said to me, do you think radiology, ophthalmology, anesthesiology, and dermatology are still the things and the road to success? She goes, I like primary care, but I just don't know how I can get married and have a family. And I said, you can if you do this. You can if you do this. I wish somebody had told me that this was an option back when I had my first job and I was seeing 32 patients in a day and I wasn't taking a lunch and I was doing notes on the time that I wasn't getting paid for. And I had to prove myself to some CEO that I could do the job of seeing the patient, but not the job of actually taking care of the patient.
It's just so demoralizing because it's not only demoralizing professionally, but it's also demoralizing to you as a human being. Because if you want to have a family, have a dang family. If you want to adopt a dog and take care of a puppy, amen. But you should not have to feel that. And I know that there's a lot of people, not even just in medicine, but just in general, since the pandemic and since, we had these work at home, now try to come back to work 3 days a week. Like people are really struggling with their value. And I love that you're able to make a difference in someone's career so early on where you didn't have that luxury for them to hear, yes, you can do all the things and still be a doctor and still be a whatever the heck you want to be because of this model.
Because ultimately, the medicine is what we do for our job. We have entire lives outside of where we work. Granted, in DPC, sometimes it gets a little bit overlapped, but we choose it that way, right? We choose to be able to see a patient after hours or speak to a patient after hours or talk to your patients at Target, which is where I see all of my patients. And they're like, what are you buying? And I say, don't look at my cart. But we are people outside of what we do for a career. Especially those of us who have families or family members that we take care of. We have other responsibilities.
It's so true. Like this morning, as you talk about science fair, my son got an award it's like a citizenship award. And I was like, I'm going to be at the school at this time. And like, it was a boundary thing, I'm sure. But I was also like, I will see you at 7:30. That is the time that I'm able to see you because I'm up and I am fine seeing you then, but I'm not fine seeing you when I need to be sitting in the bleachers at my son's school. Yeah, it definitely I love that you have had this experience already of, yeah, my family comes first and I'm also a doctor, but my family, my kid's not going to be 9 and 7 forever. They're going to be growing up every
Exactly.
day. Yeah, love
Do
that.
you find though in this model that our patients want us to spend time with our families? I get patients who call and they'll say, they leave the funniest messages. The message is always, Dr. Sui, you do not have to listen to this today or even respond, even though I know that you will, but I just have this random question at 9 a.m. on Thursday. And I'll call them back and say, I'm in the office. Like, that's my job. Like, that's the time I'm here. But I feel like our patients actually respect us outside of being their doctor, and they just want us to be so much happier because we have this great patient population.
Totally. And I think it goes back to the value that your patients find in you as a physician and as a person. And that's why they followed you. I feel the same is true for our practice. In our practice, we have so many people who are like high-fiving us in all sorts of different ways because we're choosing this model. So I think that's one. And then beyond that, they're like, I mentioned this on the podcast one time. I could not find the kennel log. I could not find the goddamn kennel log because my husband had ordered it. We were like, nobody knows where the kennel log is. And my patient shows up and I'm like, okay, can you come back this afternoon? Because I don't know where the kennel log is. And I don't want you sitting here waiting for me to find kennel log. And she said, okay, fine. That's fine. But I'm really frustrated that you didn't have a video of your kids today. That was what she was mad about. Not about, yeah, I'll come back later. That was not a big deal. It was like, I'm so disappointed because I didn't see a picture or a video of the boys today. And it was like it really does speak to what you're talking about, that our patients value us as people. It's not just as doctors. I mean, they definitely value us as doctors, but there is definitely this undertone of, we do understand that by taking care of our doctor, we are taking care of everybody in this community. So I love that.
Yeah, I love that.
And I hope that that's helpful for people to hear, especially like I remember in Minnesota, there was a couple who the wife was a doctor and the husband was very much in business. And they were expecting. And they were so nervous about being new parents in DVC. I was like, here's a bunch of people who have done that. Like, here you go. And you will still be okay. So totally, so I really hope that us chatting about this really helps people who are afraid or fearful or hesitant about being part of a family, but also being a DPC doctor. So
I, for the first time, put my kids on my December newsletter. Like, I put our family Christmas card on a December newsletter. And I got a million email replies. Like, they were just like, thank you so much for sharing your family. They're so cute. One of my patients goes, will you mail me one of those cards if you have an extra? I'm like, of course. I just think you can totally do this. See, you can do as a parent, you can succeed beyond your wildest expectation.
Now, when you were at the science fair and you're like, my MA schedule this person for another time. So tell us about the staffing at your clinic.
So I was a micro practice, considering I'm the only person there, except for when my phlebotomist is there. I am basically a micro practice, and I thought that I had a good handle on it. I thought, okay, at the point that I decided to hire a virtual assistant, I was like at 130 patients, and I thought, oh, I got this. And then I had 2 weeks where I forgot all of these things. I had started a bunch of notes, nothing was serious, but they were just like little things that life got busy. And so then I said, okay, I need to really hire somebody. And I made the decision to hire a virtual assistant because, again, my space is small and I don't really have a space for both of us. And it's just been really great because we have a great working relationship. She's a registered nurse, so she understands medicine and she gets like all of the concerns from the patient. And so it's really nice for me to be at the science fair and for her to send me a message, hey, can we schedule somebody on whatever day? And I'm like, that day is full. Can we schedule them the next day? It's been really helpful. And it's taken stuff off my plate because I am a little bit particular, you can say, but that's how I like things done. And so it's very hard for me to share with somebody on how to get stuff done in the office because I felt like the office is so much my baby, but it's been really helpful. I'm so glad she's there with me.
That's awesome. And can you tell us how you onboarded this person to your practice, because you had already 130 people registered as members?
So I onboarded Andrea by making a lot of videos. So I got on a Google Doc and I started writing everything that I do in a day, which is really actually eye-opening for me to see like how I run my day to day. And then I started making videos and a lot of algorithms because we're doctors and we love a good algorithm. And I taught her how to do everything. So we spent the first 2 weeks just onboarding. And then I always tell her, let's meet once a month and let's go through everything, see where we can make changes. She's very eager to learn. And so now I can give her a little bit more responsibility, but I taught her how to log in and order imaging, how to look for labs, how to call the patients back, how to refill medications, all of those things that I was doing all by myself. But as long as she has a step-by-step, the videos have been really helpful because the videos, she can see how I do it. And then if she has any questions, she can ask me based off of those.
I love that. And one of the things I like to highlight too is that at 130 patients in, you were still working on your business. That is so normal because some people, when they ask questions, are like, but I feel I should have all this done. And it's just our kids are growing up every day. Our businesses grow as well. And so they can't be in a stagnant place where like it's set it and forget it. And you never have to revisit it again because if you bring another person into the practice, if you move your practice, if you fill in the blank, there's so many possibilities. But even with tech, if you're adding a new piece of tech, it might change your whole workflow. Or if a workflow is not working, you can change it. But I think that's really important for people to hear too, because you're not perfect starting day one. I know that I will never be perfect in my DPC, and that's okay because that means I'm paying attention to it.
You're speaking to a recovering perfectionist. I revamped the entire business 6 months in. I revamped everything. I thought I had it set out. 6 months in, I said, this is not working at all. And I just decided not necessarily to scrap it down to zero because I had patience, but I'm like, nope, we're changing all of this. And I had to learn to be okay with that.
I'm sure there's people nodding their heads because as physicians, I feel there's a lot of type A's, I'm raising my hand included, out there who are like, but it's not done my way. So I can totally relate to that. But I think it just speaks to the flexibility of what we're doing also. So I want to talk about the medical students and residents. I love that you mentioned you have somebody even with you right now. Have you always had a medical student or resident every month or periodically through your months of DPC so far?
Yes, I've had one on with me ever since I started. In fact, the first month we were so not busy, my med student learned how to put together furniture. And we talked a lot about having a practice, and he really got to see what it was like. And it was so funny because a month later he goes, hey, Dr. Smith, I really want to do internal medicine. Will you write me a letter of recommendation? I said, really? Because you learned how to build furniture. We watched documentaries and we did a lot of questions together. But he really got to see what it was like. And that's been the greatest part with the med students. Nobody teaches DPC in medical school. So they have this idea of what it's supposed to be like in primary care from previous rotations. Every single one that comes to me, their eyes are like wide open. Like it's just giving them like, oh, wait, I can do this. You think I can do this? I really want to do primary care. Whether it be peds, FM, or IM, it's just giving them that opportunity to say, oh, there is a way that you could be happy and do primary care. And I'm like, yes, every month there's a way that you can be happy and do primary care.
Yeah. And you're like, you're describing me. You're literally describing me. I love that. And it's so important for us to see, again, that modeling that it's possible. I want to highlight your involvement in your community beyond just being present as a physician to take care of people in your community. You're very big on not only just giving lip service, but also by taking action. So you're part of the Committee to Protect Healthcare in your area. So can you tell us a little bit about what that is and what's your role on that committee?
So the Committee to Protect Healthcare is a grassroots organization built on equity in healthcare. We want everyone to have health insurance. We want everyone to have access. We do a lot of reproductive rights work, and we do a lot of progressive work in the nation. And it came to me during the pandemic. And I had a friend in Northern Nevada who's also primary care who said they're looking for somebody in Southern Nevada that they can talk to. And I'd always wanted to become more involved. Because as you also know, and many people listening know, we all have those patients who come in and say, either I get my inhaler or I don't breathe this month. Either I ration my insulin or I don't know what to do. So we know from grassroots, like we know from the ground up, like what these patients go through. And so I've always wanted to use my voice. And I had an opportunity to partner with them on some campaigning for healthcare equity and for a public option healthcare in Nevada. And then after working with them through the latter half of 2020, they asked if I would be the Nevada state lead. And I said yes. And so since the latter half of 2020, I've been able to do a lot in terms of advocating I've met with senators. I've done campaigning work. I've done a couple commercials. It's been really nice because my voice is out there in the community. That's my home now.
It's awesome. And I think that just going back to you being a DPC doctor, you have the time to spend the part of your life that you want to do advocacy and helping represent your community and speaking up for your community. You have the time to do that. And the patient visits will still come, but you'll still be able to do that. So I love that. And one of the things, you've been featured in articles as well. One of the quotes I wanted to just point out was from the Reno Gazette when you were quoted about what happens when a physician's private office is acquired by a hospital system. And you quoted the statistic that prices increased by 14.1% on average, increasing the premiums for all. So when you are speaking to policymakers, whether it be staffers or the policymakers themselves, how do you have any words of advice for people who are also speaking to their local community, whether it be Chamber of Commerce or at the state level or at the national level?
Especially with that piece, we really had to highlight that private equity and hospitals are acquiring private practices quite rapidly, and that patients are told to go to this infusion center. And if it's attached to the hospital, they get a giant bill that they would have never gotten had they gone to the solo infusion center or one inside a DPC practice. And policymakers have no idea how medicine works, obviously, just like we don't necessarily fully understand how policy works. And so what I'm trying to do is bridge that gap between medicine and policy work the best that I can. And I will say every policymaker or staffer that I have spoken to has been shocked because they were under the impression that when a large firm comes and builds and buys up private practice, that ultimately, yeah, you're saving money. And they had no idea that the patient is the one that ends up with a giant bill. And I can give you an example. I had a patient of mine who I ordered an x-ray on. She went to her local hospital and they had the same x-ray imaging place there. And then she got a bill for $400. And she would have not paid any money had she gone to the freestanding one. And I said, that is just not right. And she said, nobody told me. I go, of course, they're not going to tell you. The hospital has no obligation to tell you that, but this is how it is. So for me, I feel like the way that brings in DPC is the fact that we offer labs at a cheaper rate, imaging at a cheaper rate. Like I've got a place here where they do cash pay labs and patients will go there. That highlights the fact that there's a whole movement happening on the ground to make things more affordable that policymakers really need to fully understand. But I think this is where we can advocate DPC as a whole, right? If we just have our voices heard about what we see and what we do to change policy nationwide.
Absolutely. And even when it comes to transparency, because there's some people who, for whatever reason, they might not have access to discounted labs or discounted imaging, or that might not be a value proposition that their patients are finding valuable to them. But just like you're talking about, just the culture of use whatever you want to, your insurance or cash, but you actually have the option of knowing what the cash price is in being a member of DPC versus, oh, it's the big black box of, will I get a bill? What will the bill be? I don't know. When will it come? Maybe 364 days from now. Or you could just pay cash. It's definitely impacting people. And I love in the space where we're seeing employers, especially joining into the fold. They're like, wait a minute, you're telling me that there's no longer a black box, that I could actually pay this much and actually get this healthcare in return rather than, sorry, you can't get access to anybody who you have coverage for, so you got to go to the ER anyways. And then you get a huge bill after that. So it's really great to see the times they are a-changing. So it is wonderful to be part of this movement, especially right now. Now, when we talk about, you've mentioned collaborations that you've had, and we've talked about policy now. What about within the DPC community within Las Vegas? Have you guys met as a group to talk about how you can push the DPC adoption rock uphill in your area?
We have, through a couple of events, met together. I will say that I had spoken to Dr. Jade Norris and Dr. Jenny Lee and Dr. Ati Hakimi and Dr. Jimmy Hutt. The great thing about Vegas is it's a big city in a small city. It's a large city, but the medical world is really small and everybody knows everybody. And there's not been one person that I have called and said, hey, I have a question. Or Dr. Norris, she texted me a couple of weeks ago, hey, I need a specialist for so who do you use? There's no gatekeeping. We realize the value of DPC, though I will be very honest with you, it's a funny town. Las Vegas is a town where there are not enough primary care doctors for the amount of people that we have. There's a lot of transient people that come and go. There's a lot of snowbirds here as well. So there are people who get certain insurances that can only go to specific clinics. There are people that we joke they won't drive across town halfway because they have never done that. So they're never going to do that. So it doesn't matter how great you are, they're never going to come and see you. And we are still a little DPC pocket because there are so many concierge practices. Because again, it's a town where there is money and people who can gamble 7 figures will pay 7 figures for a doctor. And so we're still small, but we're growing, but we really do lean on each other for questions and sometimes even just to get together and say, okay, what can we do? How can we make things different? It's been really nice, like having people that I know that I can call that are in my own backyard to help me out.
Amazing. So let me ask you there, when it comes to even the community being what it is right now, clearly it's grown compared to what it used to be when Dr. Lee opened, Dr. Norris opened. It's a very different town with everybody being there. So now I want to ask about, even with that support, the amount of support you do have you had imposter days in your DPC journey?
So many imposter days. In fact, the first year, so from August of 2022 to August of 2023, not a month went by that I would look at my husband and say, this was a bad idea. What were we thinking? Like how my husband, he would be like, you could totally be an astronaut. I don't see why you couldn't be an astronaut. Like he believes in me so much more than I do. I'm more pragmatic in that way. And I'd be like, oh gosh, this was not a good month. We didn't do this. Or why did I do it like this? Or why did I tell that patient that? I think it happens because in medical school, you learn the medicine, but we have never learned the business side of it. And then in the DPC model, there are so many different versions of DPC. So yesterday, I was even speaking with a potential DPCer, a husband and wife couple, and they said, wow, you've given us so much more information. I said, yeah, because like we say, one DPC, you've seen one DPC. So I've had so many imposter days. It's gotten a lot better because now I set my 2024 goals. So at the end of December, I decided, okay, these are the things that I want to do for 2024 and grow in my business in ways that were actually like things that made sense, as opposed to when I first started my business and I was like, I want 200 patients by this day. And then when it doesn't happen, you're like, oh, I must have done something wrong. Obviously, I should just go back to fee for service.
And you're still alive and growing and practicing. So it's okay. But I love though how you said it's different now that you're over a year into your DPC, because I can relate to that a lot. Like the things that I used to have imposter syndrome about early on are very different than the things that I'm like, oh my God, today. But I think that's also where this community of DPC physicians like yourself and myself really come into play. And that's why I mentioned this after you talking about the DPC doctors within Las Vegas. It's great to have a local community. But it's okay if you don't. If you're like the one person doing primary care in your like 100-mile radius, there's other DPC doctors and we have the internet. So it's amazing. You can just reach out just like you did when you were like, I'm not afraid to call people. And most of us are just like, cool. I think that's so important to hear because it's normal. Yeah.
It's normal. In medical school, you're like, I know it. I know how the kidneys work and this is how the kidneys work. It never changes. And then you get a business and then you're like, oh, that is not what I expected. And it throws us all for a loop because like you said, we're all perfectionists or recovering perfectionists. We're all type A.
I wanted to ask about something that you had commented on. I think it was when you went to an Adele concert in Vegas, which I'm so jealous of because girl, I got to drive at least an hour and a half to get on a plane to the nearest plane to fly to Vegas. But when it comes to you as a person and how DPC has affected you, you had commented that you were an avid singer, that singing was a way of escaping for you, and you had lost that along the way. How has DPC helped bring that person back who's just untethered and who, if you want to sing, you can sing whenever you want now?
I love this. I will also say that I will have singing breaks in my office where I'll just turn the radio on and I dance around because I'm like, oh, I haven't moved in an hour. Like maybe let's just dance and sing. It has given me freedom. It's brought me back to myself. Let me say that. It has brought me back to myself. I was a fun-loving, always extroverted, up to do anything kind of person. And personally, when I had both of my children, I had postpartum depression and anxiety, and it really threw me for a loop. And so I had come to this conclusion at 37, actually, after I had my second one, my now 7-year-old. I thought, this is just my life. My life is to wake up every morning, take care of my children, go to this job that I hate, see these patients, get yelled at by administration, come home. And that's just how my life is going to be. And when I was at the Adele concert, just listening to her talk, which, hello, bucket list, anytime you want to come see her, I will go with you anytime. The fact that she was like, this is my story. This is where I came. This is where I am now. She had closed her concert down. So everyone bought tickets. Then she said, I can't do this. She revamped the concert and she opened up. That's no different than what I did. I had a DPC in August. 6 months into August, I was like, I can't do it this way. It's not going to sustain this way. And I'm not happy. Let me make a change. So it gave me the ability to look inside myself and say, Harpreet, you have an intuition in there and you have a gut in there where you want to be. You do not have to be there tomorrow. And you can have the life that you want. So I can sing again because I'm happy again. If I have the practice, I get to be the doctor I want to be, but I also get to be the friend I want to be. I get to go have lunch with my girlfriends. I get to go to the science fair. I get to see my husband. Like, I have a whole rich life now as I go through my 40s. And it's just been everything I've ever wanted and so much more.
Absolutely incredible. Thank you so much, Dr. Sui, for joining us on the podcast today.
Thank you so much for having me.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.